Hello, everyone. Hi, everyone. Today we are here from UCHealth to present on the topic of multi-sport youth athletes and sports specialization as part of the D20 School District Safe to Play Enrichment Series. So my name is Jessica Parton. I am a physical therapist with UCHealth, where I specialize in working with orthopedic and sports medicine conditions. I've been a physical therapist for about 11 years and completed my Doctor of Physical Therapy degree at University of Pittsburgh in Pennsylvania. I'm also a board-certified clinical specialist in orthopedics, and I've completed several certifications related to management of running and endurance athletes. I grew up as an athlete myself, participating in gymnastics, lacrosse, track, and cross country. So orthopedics and sports medicine has always held a special place in my heart. And I've experienced working in both coaching and physical therapy settings with athletes of all levels, from beginner, coaching 3rd through 5th grade girls on the run, and developing young athlete programs for school systems, to recreational, competitive, and elite athletes from high school and collegiate through master's level. So then we've also got Renee presenting.
Hello, my name is Renee Meyer. I am also an orthopedic physical therapist at UCHealth over at the Grandview Medical Center. My background is primarily treating musculoskeletal injuries, and I have a few certifications as well, including I'm a certified strength and conditioning specialist. I also am board certified in orthopedics, and I have a Pilates certification. I have a long, personal history with sports, starting at a young age, playing tennis and soccer, basketball, rowing, and then experiencing a season-ending volleyball injury at the age of 17. And so I do have that special interest in sports injuries, especially in high school, and really looking into the prevention of them. So we are going to transition into our presentation. But first, let's go over the objectives. So today we're going to describe sports participation trends among youth athletes, identify considerations for multi-sport participation and sports specialization, develop an understanding of research related to risk and benefits of different levels of sports specialization, and discuss recommendations for safer participation in youth athletics. The young athlete on the left began walking at the age of 6 months. He won his first 10 and under golf tournament at the age of 2. When he was 4, his father would drop him off at the golf course and pick him up about 8 hours later. He was able to beat his father at golf by the age of 8. The athlete on the right, on the other hand, dabbled in soccer, skiing, wrestling, swimming, handball, table tennis, badminton, and squash. He recalls liking any sport as long as it had a ball. He began to focus more on tennis in his teenage years. When his tennis instructor decided to move him up with the older players, he asked if he could move back so he could stay with his friends. Who are these athletes today? Tiger Woods and Roger Federer first met in 2006 at the apex of their sports careers, when Tiger flew in on his private jet and to watch Roger win the US Open. Each of these two athletes took a very different path to reach the top of their respective sports. Another example of a multi-sport athlete is this woman. So Esther Ledetka, she's a Czech athlete, was the first woman to ever win a gold medal in 2 different sports, snowboarding and skiing. She was a multi-sport athlete as a child and still plays beach volleyball and kite surfs to this day. Another example is Tom Brady. He was first drafted into the Professional Baseball League prior to his current NFL career. And you may or may not recognize a few of these athletes here. On the top left is the U.S. national women's soccer player, Abby Wabach. She also has 2 gold medals. She lettered in basketball in high school. Then there's John Elway. Of course, he's famous for his NFL career, but he also played baseball in his youth. And these are all other athletes that have have something in common related to their athletic development. They all participated in multi-sports as youth athletes. So there's a growing body of research out there indicating sports sampling or participation as a multi-sport youth athlete is associated with decreased risk of sports injury and burnout. Many of these athletes credit their multi-sport beginnings as contributed to their athletic success later through benefits of spatial awareness, agility, hand-eye coordination, endurance, and mental health skills that translated between sports. Now, Jessica will give us more background on youth sports.
So as Renee said, a lot of these athletes credit some of their success to being multi-sport athletes, but let's not just take their word for it. There's a lot of information regarding youth athletes and sports specialization. So today we want to also debunk some of those common myths related to sports specialization and go over some of the relevant research. All right, so a little bit of background. For the past decade or so, youth sports specialization and youth sports participation has been increasing. The American Academy of Pediatrics estimates that between 30 and 50 million youth aged 6 to 18 participate in athletics yearly. And we know the benefits of sports are extensive. Benefits include physical fitness, motor coordination patterns, leadership skills, self-esteem, socialization, teamwork, and many more. As participation in youth sports has increased, we said there's also been a corresponding increase in the number of athletes choosing to specialize in a single sport. So sports specialization can be defined as intensive year-round training in a single sport at the exclusion of other sports. The American Orthopedic Society for Sports Medicine defines early sports specialization as the following. 1, intensive training and or competition in organized sports more than 8 months out of the year. 2, participation in one sport to the exclusion of participation in other sports. And 3, involving prepubescent children. The American Journal of Sports Medicine defines a spectrum of sports specialization based on low, moderate, or high specialization. And that's based on the following criteria: choosing a main sport, participation for greater than 8 months out of the year, and quitting all other sports to focus on one sport. On the other hand, we have sports sampling. So sports sampling can be defined as playing more than one sport over the course of the year, or multi-sport. So there are a number of factors that may contribute to a desire for single sport specialization, which we have listed here. Factors like a young athlete's enjoyment of a sport, hope of the athlete getting a competitive edge, pursuing scholarships or professional status, or being able to be labeled as elite. So many athletes, their families, and even some coaches believe that sports specialization may be key to long-term success. And many of these ideas actually stem from perceptions of Eastern European athletic programs, like from the 1980s, and also even examples like the Tiger Woods example we gave, where we have athletes who are child prodigies. And there's even some psychological theories, such as the 10,000 hour rule, which was published in the Journal of Psychological Review through the American Psychological Association. And they looked at the role of deliberate practice in acquisition of expert performance. Their theory stated that to become an expert as a chess player or musician, 10,000 hours of deliberate practice is needed. And more recently, Malcolm Gladwell evaluated this concept in his 2008 book, Outliers. So while that 10,000 hour rule seems to be true for chess players and musicians, it may not actually be the case when applied to sports. While many hours may be helpful to reach elite levels in athletics, the research indicates that the practice does not need to be deliberate, and in fact, too much deliberate practice or single sport participation may be detrimental. So despite some perceived advantages to single sport specialization, the literature does not support this practice. In fact, research indicates some of the following statistics related to sports specialization and intensive training in young athletes. As many as 70% of children discontinue sports by the age of 13. At least 50% of athletic injuries are related to overuse. Only 1% of high school athletes receive any scholarships. Between 3 and 11% of high school athletes compete at the NCAA level. And between 0.3 and 0.5 high school athletes reach professional level sports. So let's go through some more of the specific evidence and we'll kind of debunk some of those common myths we mentioned. So myth 1, you need to specialize in one sport in order to play in college or professionally. So this, of course, is false. Research and data tell us otherwise, with multiple studies showing that the majority of athletes who go on to play in college or professionally actually participated in multiple sports as a child. According to a 2012 study by the American Medical Society for Sports Medicine, 88% of college athletes participated in more than one sport as a child. A 2017 study of early single sport specialization among over 3,000 high school, collegiate, and professional athletes found that collegiate and professional athletes tended to specialize an average of 2 years later than other high school athletes. And this challenges the idea that success at a higher level or elite level requires specialization at a young age. A 2019 study from the Orthopedic Journal of Sports Medicine analyzed sports specialization among NCAA Division I collegiate athletes. It looked at over 300 athletes across 19 different sports and showed that only 17% specialized by 12. Additional evidence among professional athletes is listed here. So we have 88% of the 2008 NFL draft picks who were multiple sport athletes in high school. And then we can see similar trends over the years. For example, of the 300 players invited to the 2015 NFL Scouting Combine, 87% of those athletes were multi-sport athletes in high school. And those findings are comparable also across international athletes. A 2016 study from the European Journal of Sports Science examined German national team football players versus amateurs and found that the national team players participated in more childhood, non-organized leisure football, had more adolescent engagement in other sports, later specialization, and played organized football at age 22 or older compared to the amateur football players. Similarly, a 2017 study from the Journal of Sports Science compared athletic development among international Olympic and world champion medalists versus non-medalists and found that the medalists had greater participation in alternative sports, later specialization, and maintenance of engagement in other sports over more years compared to the non-medalists. So then myth 2, children need to play their sport year-round to avoid getting out of shape or injured. So this is also false. In fact, early sports specialization is one of the strongest predictors of injury in children. Among a study of over 1,200 athletes, those who specialized in one sport were 70 to 93% more likely to sustain an injury than those who played multiple sports. A retrospective study of over 500 high school athletes found a relationship between the development of patellofemoral pain syndrome and single sport training in basketball, soccer, and volleyball. The athletes who specialized in one sport early on were found to have a higher risk of anterior knee pain disorders, including patellofemoral pain, Osgood-Schlatter, and Sinding-Larsen Stevens-Johansson disorders. Another study of over 700 Major League Baseball athletes found that early specialization was associated with upper extremity injuries in throwers and fewer games played. A 2017 study from the American Journal of Sports Medicine included over 1,500 high school athletes and found that those who specialized in one sport were 2 times as likely to report a lower extremity injury compared to those who played multiple sports. Furthermore, 60% of the athletes that specialized in one sport sustained a new lower extremity injury over the following school year. There was also a correlation between the degree of specialization and injury, such that athletes with moderate or high specialization were more likely to sustain injury than athletes with low specialization. So our table here shows some of the specifics of the correlation between degree of specialization and injury. Similar correlations have been found in additional research. A 2015 study of over 1,100 athletes aged 7 to 18 years old compared training patterns of injured athletes versus uninjured athletes and found that those who met the definition of highly specialized had 2.25 greater odds of having sustained a serious overuse injury than the unspecialized athletes. And that was even when accounting for hours per week of sports exposure and age. A 2018 systematic review and meta-analysis in the Journal of Pediatrics found that high specialization athletes were at an increased risk of sustaining overuse injury compared to low and moderate specialization athletes. And moderate specialization athletes were at a higher risk of injury compared with low specialization athletes. So in summary, specialization does increase the risk of injury, and the more specialized an athlete is, if they're falling into that high or even moderate specialization category, that correlates to also having a higher risk of injury. So then I'm going to trade off to Renee for our third myth.
Myth number 3. Those who spend their time learning one sport as a child are more likely to stay active throughout their lives. This is also false. In fact, those who specialize in one sport early in life were found to be the first to quit their sport and ended up having higher inactivity rates as an adult. There's one study that recognized that about 35% of young athletes quit participation in sport each year, with sports attrition rates being the highest during the transitional years of their adolescence. There's also about a 70 to 80% attrition rate by the time children reach 15 years of age. So the American Journal of Sports Medicine analyzed sports sampling, which again is that multi-sport participation versus sports specialization across many studies. And so it basically indicated that playing multiple sports was associated with longer playing careers, better confidence, motivation, better motor control and athletic development, and the ability to transfer these skills to other sports with greater ease. They also found that sports sampling at a young age is associated, again, with those neuromuscular control and fewer movement errors. Now, with this, that allows for that reduced injury risk in young athletes. So that probably correlates well with the research that Jessica just presented. In addition, sports satisfaction surveys reveal having fun is the main reason why most children like to participate in sports. However, the parents' perception is that their children like to play to win. And so that's an important thing to recognize, is kind of that parental influence and parental impact on a child's really perception and their pursuit of continuation in sports. In addition, the orthopedic, Journal of Sports Medicine also found that athletes who specialize reported clinically significant higher level of burnout. We're going to talk a lot more about this in a few minutes. But that also has to do with specializers' greater sense of reduced accomplishment, greater exhaustion, and more devaluation of themselves and the sport. There was one study that indicated that gymnasts who specialized earlier spent more hours training. From the ages of 14 to 16, they also reported lower perceived levels of health and overall less fun. And then another helpful study about junior tennis players who burned out reported they had less input in their training, higher perceived parental criticism and expectations, and lower levels of extrinsic motivation. So moving on to risks of specialization, we've talked about several of those between injury, burnout, but there's also other research that indicates social isolation happens. And that's just related to being very specific, hanging out with a certain number of people since they're only doing one sport. There has been some signs of dysfunctional family dynamics, overdependence on others, and increased risk for abuse, loss of control over their lives, behavioral development delay, social maladaptive behaviors, overuse injuries. We'll talk again more about that shortly. Early retirement of sports, and that could be from injury or mental health. Depression and anxiety can be higher. There's a financial burden, of course, and then missed opportunity in other sports that they may enjoy or excel. Biomechanics of youth injuries. Kids are not just small adults, so we have to remember that muscle, ligaments, and bones of adolescents aren't fully developed yet, and they experience rapid periods of growth or growth spurts that can limit their flexibility. It also makes those particular areas or their growth plates more prone to injury. In addition, their cardiopulmonary system isn't fully developed, so they can't function at as high a level as sometimes expected. Something to keep in mind too is puberty onset is about 8 to 13 years for females and 9 to 14 for males. And so peak bone mass isn't actually achieved until about 20 years of age. And that 90% of bone mass is attained by 18, but the greatest greatest increase in that is between ages of 11 and 15. So the risk factors for overuse injuries. So we just talked about some of the intrinsic risk factors, which is related to growth spurts, growth plates, previous injuries, previous or prior level of conditioning, anatomical factors, menstrual dysfunction. We'll talk about more of that in a minute, and then psychological and developmental factors. So extrinsic things that we can help control more of would be training workload. So it's going to be the rate, intensity, and progression of athletes, their overall training and competition schedules, of course, making sure their equipment and footwear is appropriate, the overall environment they're participating in, their technique, and then psychological factors also play a role. So overtraining syndrome. So that's caused by training frequency or intensity that is too much or increased and without sufficient rest or recovery. So those symptoms can include headache, fatigue, muscle soreness, decreased immunity, pain, sleep disturbance, and poor performance. The female athlete triad, or for males or in general, relative energy deficiency in sports, that is low energy availability. And this can be with or without disordered eating. Decreased bone mineral density is a result of it. And there's also hormone dysfunction. And so that can be menstrual dysfunction in females and then decreased testosterone in males. Signs of burnout. These can be psychological changes, physiological changes, as well as hormonal changes. So these potential symptoms to look for in your young athletes would be decreased sports or school performance, lack of motivation, and that's particularly the intrinsic motivation, or as student athletes, overall just motivation to perform and participate in school activities. No longer having enjoyment in the sport, high perceived stress and anxiety, chronic pain, personality or mood changes, elevated resting heart rate, fatigue, lack of enthusiasm or ambition, difficulty completing a typical routine, sleep changes, decreased appetite, and then an increased risk of or increased injury, illness, or infection. So how do you prevent burnout? So sports diversification, the theme of today, avoiding overscheduling excessive time commitments. The recommendation is to allow 1 to 2 days off per week of organized sports. In addition, taking 2 to 3 months off per year of organized sports. And then during practice, really emphasizing skill development and fun, age-appropriate games, of course, lifelong physical activity skills, and encouraging athletes to listen to their bodies. There are 2 questionnaires out there right now that they have been researching more to help better acknowledge and better really be able to see if the athletes are experiencing burnout. And so one is the athlete burnout scale, the other is the athlete burnout questionnaire. These look at 3 different dimensions of it. So one is the reduced sense of accomplishment, physical exhaustion, and negative feelings towards the sport that may present. So when should you specialize? So there are some sports that are an exception. So this is which peak performance may occur before actual full physical maturation. And those are gymnastics, diving, and figure skating. And so the recommended stage of specialization is actually early adolescence. Meanwhile, team sports, tennis and golf is more in that middle adolescence timeframe, and then endurance sports or track and distance events is more late adolescence. So thinking late high school or even really those early college and 20s to focus more on endurance sports. Of course, things we have to pay attention to, especially for gymnasts, figure skaters, is the female athlete triad or the relative energy deficiency in sports. So other recommendations, in 2014, the U.S. Olympic Committee, along with national governing bodies, used the long-term athlete development principles to create this model. And so as you can see, it starts right away in the young 0 to 6 years of age, and that's focusing on active to start. And so the focus is more just on movement. And then transitioning, so training to train, that's more learning to compete and emphasizing building physical and mental capability. And then training to compete and training to win, that's truly the high performance in the sport. The US Olympic Committee, their key principles when they researched and looked further into the development of athletes, their focus initially is, of course, or their principles, universal access to create opportunity for all athletes, developmentally appropriate activities to emphasize motor and foundational skills, multi-sport participation, fun, engaging, and progressively challenging atmosphere, and quality coaching. Their outcomes, of course, that they want to generate is really to grow both the general athlete population and the pool of elite athletes in which future US Olympians and Paralympians are selected, develop fundamental skills to transfer between sports, provide appropriate avenue to fulfill an individual's athletic potential, and create a generation that really loves sports and physical activities and will transfer that on to the next generation. So the 5 stages that the US Olympic Committee model demonstrates is stage 1, which is ages 0 to 12, is to discover, learn, and play. Then ages 10 to 16, development and challenging these athletes. Ages 13 to 19, training and competing. Stage 4, excelling for high performance. And then the other part of that is to participate and succeed. And then 5 is thrive and mentor. So really that active for life. Right, so from the Brenner article in 2016, they developed this really helpful infographic, and we went over some of this during the presentation, but just that reminder of the guidance is taking at least 1 month off from a sport at least 3 times per year. So this is what we referred to earlier as that 2 to 3 months off per year. And this allows for the physical and psychological recovery of the athlete. Our primary focus should be lifelong physical activity skills and overall having fun, encouraging participating in multiple sports to decrease the risk of injuries, stress, and burnout, delaying specialization in a single sport until late adolescence. And this may actually lead to higher accomplishment from an athletic goals perspective of thinking about working into that collegiate level or professional participation. So overall, early diversification and later specialization really provides a greater chance of lifetime sports involvement and decreased risk for injury. So in summary, the research states there's no strong evidence that early specialization achieves elite athletic status. And of course, we have to keep in mind those few sports that there are some early peak performance, like gymnastics, figure skating, and diving. Also, early sport specialization is associated with increased injury risk. Early sports specialization is also a major risk factor for burnout and lower future sports participation. So what should you do? Diversify participation in multiple sports. Focus on fun and learning lifelong skills. Make sure you take time off from organized sports. So that's 1 to 2 days off per week and 2 to 3 months off per year, especially spread out if possible. And then monitor young athletes for signs of overtraining and teach them to listen to their bodies. So the don'ts: play one sport more than 8 months per year. Participating in organized sports more hours per week than the child's age. So if a child is 12, not going more than 12 hours per week. And then there's also a general, if they looked at the most amount between injury and burnout, it was actually the 16 hours per week. So not exceeding 16 hours per week of participation in the sport. Here are our references. If you want to look up any articles or books that were represented. And thank you for your time. If you have any questions, our email addresses are listed below. Again, I'm Renee Meyer, and Jessica Parton was presenting earlier. Thank you.